Hello, everybody. Welcome to our 20th Disruptive Fridays conversation. Today, I'm so delighted to be joined by three fantastic speakers to focus on the bigger picture of the situation that we're all still living in at the moment, which is the pandemic and the rollout or lack thereof of the various vaccines across the world, which we've specified today as the Global South. Obviously, it goes without saying that the Global South is a huge proportion of the world. It's billions of people. And we're barely going to scratch the surface of issues today, but scratch the surface we will. And together, Dr. Jacqueline Klopp, Madlen Davies and Ido Vock will shine some light on the local and global implications and consequences of COVID-19 and the unequal distribution of vaccines in parts of the world that presumably most of us are not currently in. The COVID-19 pandemic, and especially the highly politicized, increasingly chaotic vaccine rollout, has really revealed pre-existing weaknesses in state structures and international aid, as well as creating opportunities for corruption and quite a lot of political fallout. And in a multitude of ways, it's actually really been a complete failure of international cooperation, which we'll go into. Obviously, it's debatable. And it's all the more concerning as it seems highly probable that mutations will continue so long as the virus is not under control. So for those of you who may already have had the jab and may be watching, the long-term efficacy of it will most likely depend on what's happening in parts of the world that we'll discuss today. So highlighting what's going on and what's going wrong is really important, and I'm looking forward to hearing our speakers' various research and insights today. Jackie will be kind of taking the Africa mantle, talking to us a bit about COVID and corruption in Kenya, where she's currently researching, and also what corruption might mean for the vaccine rollout there and vaccine hesitancy. Madlen will be sharing her most recent research into vaccine procurement contracts, including quite dodgy indemnity agreements in Latin America. And Ido will be kind of joining the two together and talking us through the bigger picture of such uneven vaccine distribution. And I suppose in many ways, this lack of global solidarity is perhaps inevitable in times of crises. But the snapping up of the world's supplies has been quite an uncomfortable thing to watch over the past few months and essentially the past year. But I'm looking forward to delving into that issue today and having a wider conversation among ourselves about the points raised. Speaking of which, that is a chat box on the website. Please send us your thoughts and comments and questions throughout the conversation, and I'll put them to the panel at the end. And I'm really hoping for an interactive discussion. So type us a question or anything. And if you're watching this anywhere that's not on our website, we won't see your comments, so don't comment on the website. So over to Jackie. Dr. Klopp, is co-director of the Centre for Sustainable Urban Development at Columbia University in New York. She's joining us from over there. And she's part of Global Integrity's Anti-Corruption Evidence Programme, which is exploring corruption, gender and small-scale cross-border trade. So, Jackie, it's really lovely to have you with us. It would be great to hear from you what you've been seeing, what the situation is there, and what we can learn from you today.
Thanks so much, Alannah, and thank you so much to the Disruption Network Lab for convening this really important conversation right now during these really difficult times with our pandemic. And what I want to really emphasize is that this pandemic is a governance crisis. It's a corruption crisis as well, besides being linked potentially to our ecological crisis and our climate change crisis. So we have a lot going on that we have to address. And like you're saying, Alannah, getting our governance in order and our global cooperation in order is critical. And this pandemic is not only a reflection of this series of crises, but also becomes a new opportunity for corruption. And what I'm going to give you a little glimpse of is some of what's happening in Kenya based on this research that I've been doing for the Global Integrity Anti-Corruption Evidence Program. which focuses on these small-scale traders who are primarily women, and they're really, really important to their communities. They take foodstuffs and other critical products cross borders to different towns. So they have these wide networks that they distribute food and other goods to different communities, and they manage to make a living out of this. So they're very important. One of the things that happened with COVID was a closing of borders. So very early on in March of last year, when the crisis was unfolding, one of the first reactions of governments was in the region was to shut borders, which without thinking about how do you actually mitigate some of the negative implications of that. Later, the borders were opened, but for mostly large-scale traders who could afford a COVID certificate, so showing that they had done a COVID test. This certificate and the test costed, around around $60. So a lot of money for, let's say, the average household in Kenya that makes $200, a month. So that's an enormous cost. So these became really big barriers, and one of the ways that women in these regions have typically addressed corruption at borders, which is really endemic, is they use these porous routes to continue with their business. And in these porous routes, they meet security officials who extract a lot of bribes, and also there's a lot of sextortion that happens. So our research has shown when these new restrictions around COVID took place, we saw an increase in corruption, and a lot of women dropped out of the trade with a lot of suffering, of course, and others tried to continue, but then were subjected to larger amounts of bribes. So the people who were already engaged in corruption basically, and it found COVID as a great opportunity to increase their take. And then you have to question, so coming to the really big picture here, you have to question how serious the government of Kenya and Uganda, so I was looking primarily at the border between Kenya and Uganda, also Kenya, Tanzania, which is another complex story. You have to question really how serious the government is taking the COVID crisis and whether it's primarily seeing it as an opportunity for corruption. And clearly, making a very expensive test one of the criteria for crossing the border opens up these, possibilities. Here in New York, for corruption, here in New York, our testing is free, right? Because we don't want anyone to not be tested that needs testing, and money should not be a barrier. Not that the US is a paradigm of good practice in healthcare or any of these issues, but it happens to be that our city has made this available to us. And also, it's well known that these porous routes exist, so there should have been an intervention to help these women again, get tested or be able to, have access to masks and free healthcare advice, and certainly not be subjected to more extraction and sextortion. So, and this experience that we're seeing on the border areas of Kenya is also something you see in the poor neighborhoods in Nairobi, the capital of Kenya, and many of the poor communities in Africa. And I should also actually point out that there's also has been in many places, including Kenya, an increase in police brutality as well. So the COVID restrictions, again, an excuse for, a disproportionate force on people and extraction. So if COVID is going to be primarily seen as an opportunity for corruption and then exacerbating some of these deep problems, we're in a lot of trouble when it also comes to the vaccine. I should say that the Kenyan government has tried to provide cash transfers to low-income families. But one interesting thing is that they don't actually have a proper database or mechanism to do that. And one of the reasons they don't, according to some research from my Kenyan colleague, Victor Rateng, is that they don't have any privacy laws in place, and a really legal framework to be able to do that. So overall, there's great distress around COVID in East Africa, in Kenya, and deep, deep mistrust of the government. So if you see these, the ways that corruption is actually getting worse under COVID, clearly people don't trust their government, and trust their government to deliver a safe vaccine. And here is the tie again with the discussion around the pharmaceuticals. I'm really excited to hear from Madlen about this. There's a history of pharmaceutical companies not behaving properly on the continent, dumping drugs that are ineffective, for example. There was also, there's also corruption in terms of, provision of drugs. So Kenyans are very familiar with the problem of fake drugs getting out on the market. So failure of regulation that's linked again to a corrupt dynamic. And so one of the things we're seeing is great distrust that's exacerbated by, Alannah, you mentioned AstraZeneca, the misinformation, the bungling of those, the trials, the data around the trials, I should say, by the pharmaceutical company. All of this, we're in a global world, is circulating back. And what we're seeing is at just a lot of hesitancy, including among very, reasonable people because of this. And if that's the case, like even if we can solve this really difficult problem around access, and getting over our complete failure of global cooperation around this issue, we're still going to have problems delivering these vaccines. And Alannah, you talked about global solidarity. I think one of the lessons is that, especially looking at the way these small-scale traders organize and the way poor communities work to help each other in these difficult times, something we saw when they were facing, let's say, the HIV/AIDS crisis, that we really need to have global solidarity to support African civil society, and those groups that are building and trust and have the trust of people and could be key in terms of delivery and accountability of delivery of vaccines. Kenya actually has a shipment of AstraZeneca that has come in, but it's really unclear how they're going to actually deliver this vaccine. And those who actually want it are having problems accessing it, and then a large number of people are skeptical. So this is a really, really big problem for us to solve with global solidarity, with working with civil society groups that are working on anti-corruption, transparency, better governance is at the core here. We really need to be able to address this critical problem. Otherwise, we are going to continue to face this pandemic for a really long time, because one of the things that the public health experts have explained very clearly is the longer we allow this virus to spread, the more mutations it will have and the less effective our vaccines will be. Now, there are some companies like Moderna who have a technology that can continually create boosters, but then this creates a perverse incentive not to really address this pandemic in a comprehensive way, because the wealthy people, like you were saying, Alannah, will be able to get the boosters, and the folks who are on the other end of what you called vaccine apartheid, will be out. So I'll stop there, but
Thank you.
looking forward to talking about it.
That was brilliant. Thank you so much. I really loved how you kind of introduced as well your research based on, you know, the struggle for corruption and inequality being key for public health, as with so many things. It's completely connected. And I have so many questions, I think, to go into when we open up a discussion. And also just to say that the research paper that you were working on with Global Integrity, I think Global Integrity's anti-corruption evidence project paper was published this week, and we'll share it in the chat, and it's definitely worth reading. So from Africa to South America, Madlen Davies is Global Health Correspondent at the Bureau of Investigative Journalism and has been engaged in some absolutely brilliant reporting into issues with vaccine procurement in South America. So Madlen, thank you so much for joining us, and please share some of your insights into the concerning contract negotiations between Pfizer and Latin American governments there.
Apologies, the classic failing to unmute there. So yeah, thank you very much, Alannah. So I'm the Global Health Correspondent at the Bureau of Investigative Journalism. So for the past year, I've been reporting on access to medicines and health inequalities in relation to COVID-19. So I've looked globally at the supply chain of the sedatives and the anesthetics need to put COVID patients to sleep.
Okay, we possibly may have a few issues. I can't really see what's going on, so okay, maybe we'll come back to Madlen in a little bit because she's got some great research. Okay, well, let's go to Ido, who is the New Statesman's international correspondent, and he's been covering COVID-related issues for, past year, I suppose. And it's really great that he's with us now to kind of sum up the big picture of the vaccine rollout and why it's, you know, been so sort of unevenly, perhaps chaotically, and I'm thinking of Italy allegedly hiding 29 million doses of AstraZeneca vaccine distributed in recent time. And obviously we've sort of touched on the situation in East Africa, and we'll come back to the situation in Latin America. But it would be great to hear, your thoughts, Ido, and a summary of kind of the COVAX program and how it's going.
Yeah, thanks very much for inviting me. It's a real pleasure to be here. I suppose the first thing to say about the vaccine rollout globally is that we kind of tend to talk about it as though there's a fixed supply, as though, like, I don't know, it's a natural resource and there's a certain amount of it out there, you know, in the same way that, like, there's a certain amount of gold to be mined, and once you've mined it all, then that's it. But of course, that's not really how it works, because vaccines have to be manufactured, and they have to be manufactured in kind of factories which have to be built and funded, and the people trained and the equipment bought, and, you know, the process is streamlined and so on. All of which to say that we are having a massive shortage of vaccines. Obviously, it's some very high profile rows, particularly around the EU in recent weeks, have highlighted. As I've written for the New Statesman and covered repeatedly, the global south, which we're talking about here, particularly Africa, but also Latin America, parts of Southeast Asia, parts of the Middle East, are really being left behind, and they're getting very, very few doses. They're getting a handful of doses, but really, I mean, a handful, you know, no more than, in most cases, a few 100,000 from COVAX, which is the WHO's vaccine sharing initiative. But by and large, the lion's share of doses administered have been to the rich world. And in fact, we've in recent weeks, particularly with the EU and the disputes between the EU and especially AstraZeneca over AstraZeneca not fulfilling its contracts and its agreements, and allegedly, according to the EU, exporting doses to other countries from the EU instead of giving them to the EU. We've seen the effects of this kind of underinvestment that there was, because the factories were not, basically the factories that were needed to create the vaccine and manufacture the vaccines just weren't funded early enough. And the current shortage is in large part, I think, a result of kind of too much penny pinching too early. And in fact, the countries which have done well out of this, in particular the UK and the US, less so with Israel because it gets its supply from elsewhere, but the UK and the US were very smart in basically chucking loads of money at vaccine production. And they're now early on, so last year, with things like the US's Operation Warp Speed, with the results that they are now seeing and doing doing very well, and getting many more doses than their competitors, than their kind of other countries out there. The vaccine rollout has been very unequal, but it's unequal for a couple of reasons. One of which is underdevelopment, and as we've seen actually with underinvestment, and as we've seen with AstraZeneca and the kind of Serum Institute in India. Obviously, there is no inherent reason why a developing country cannot produce its own vaccines, and the Serum Institute is exporting a lot of. It's creating many doses for the domestic Indian market. Indeed, I think it's exporting some to the UK, and it's also exporting doses to neighbouring countries, so places like Sri Lanka, I think Nepal, places like that. And is sending doses through COVAX to poor countries across the world, including Africa and parts of Europe, parts of the Middle East. So yeah, I would kind of caution against seeing this purely as a matter of egotism, just because it's not as if there is a kind of fixed supply out there that should be divvied up and is unequally being divvied up by rich countries and poor countries. It's more that the rich countries, which are now getting the lion's share of the supply, invested a lot of money. And if you kind of look at the cost-benefit ratio of vaccines, there are some estimates that vaccines are worth something like, I think one estimate put it at something like $8,000 per shot. And obviously these are vaccines which cost something like, for the AstraZeneca, it's I think under about $30, something like that. So the cost benefit analysis, even in very poor countries, is marked. So that's what I'd say. But I'm open to other questions and kind of further discussion on this.
Absolutely, thank you. That was a great sort of explanation of what your take is. Any chance we can get Madlen back? Has she gone? Okay, well, perhaps while we wait for her to return, I can kind of combine Ido and Jacqueline into a bit of a conversation. Before we started today, I was just picking Jacqueline's brain over something I read, which is I was looking at countries which are on the COVAX scheme, and Madagascar hasn't applied to join the scheme because various reasons. But I tried to fact check this, and correct me if I'm wrong, Jacqueline, but they're going with a herbal remedy, and which is sort of I think their president advocates. And we were sort of talking about how, obviously, perhaps we're very ill placed to have a conversation on cultural attitudes in Africa, but vaccine hesitancy in the global south, in Africa in particular. I know Jacqueline's got research on that. Perhaps we could open that up while we wait for Madlen.
Sure. We'll give privilege to Madlen if she pops back up, because I'm really excited to hear from her. But I think there is a really big problem around getting access to this vaccine in places like Africa. There is somewhat of a parallel with the struggle around HIV/AIDS that hit parts of Africa very severely, including South Africa. And, the cost of buying the pharmaceuticals sort of on the, on the market was astronomical, and yet there were huge numbers of people dying horrible deaths from this terrible disease. And at an initial point, the president of South Africa at the time also wanted to find local solutions, and that is not, that's not irrational, to try, like many of us might do, homeopathic remedies. And part of, I think, the sort of wishful thinking behind that is that these drugs are just so expensive to buy, and there's already a shortage of healthcare in these countries. So even the delivery of addressing this problem was astronomical. However, activists and civil society really pushed. And at one point, they just said, we're going to start, generics, and we're going to ignore your intellectual property claims that are making these drugs far too expensive for us. So I think that's a really important question, and I feel maybe my position is a little different from Ido's. Ido, you didn't mention the intellectual property claims that pharmaceutical companies make, even when it is national governments, public money, taxpayer dollars that fund the bulk of this research that these pharmaceutical companies use. Their advertising budgets are bigger than their research budgets. And so there is a plausible, in fact, a very compelling public health reason for all of us to say we need to deliver this vaccine as quickly as possible. So we need to overcome the IP barrier. And also, as you do mention, Ido, and I totally agree, like these vaccines are not something you just mine. Like you really do have to set up manufacturing. And given the probabilities and continuing chances of having these pandemics, we've seen them before, we should have those manufacturing capabilities set up to be able to manage this. So again, I think that's a bit of a failure. But I think we do, as the discussion is at the World Trade Organization, we do have to start thinking about a waiver on IP to start, just ramping up, at least for a period of time, the vaccine production and getting it out there at a reasonable cost to the rest of the world. And our public health is dependent on doing this. There, right?
And I think people are beginning to realize that, though, aren't they? And I think that's why there's increasingly a lot of interest in how the COVAX scheme is going and in the international rollout of vaccines. And actually, I've asked someone to post a few links to articles and vaccine trackers in the chat for people just to have an explore out more generally. There is one from the New Statesman, actually, that I found last night, and also the BBC has a free access vaccine tracker, and hopefully we can all become invested in the rollout of global vaccines, not just in our own bodies. Okay, so I suppose while we're we have had a few questions. I'll come to them in a bit. Thank you, Kenny and T-Baz, for sending them in. Okay, so let's take a slightly different approach now. So we've spoken a little bit about corruption. Ido kind of touched on, the sort of wealthier countries taking the lead in manufacturing vaccines. I know Madlen's, shame she's not here, but she's written a lot on the global vaccine apartheid. And I wonder whether this is a bit too hypothetical a question to ask, but with the dawn of sort of vaccine nationalism, is COVID revealing the end of globalization? Hold that thought.
Hello.
Madlen's back. So, Madlen, it's brilliant to have you here. Tell us a little bit about what you've been looking into in Latin America with Pfizer contracts.
Hi, Alannah.
You're back. We can hear you. Wonderful.
I'm back. Oh, great. Apologies. Yes, thank you. So you. Sorry, shall I go back to the beginning?
Please. Yes, begin.
Yeah, so thanks. Yeah, so I'm the global health correspondent at the Bureau of Investigative Journalism. So for the past year, I've been reporting on access to medicines and health inequalities in relation to COVID-19. So globally, I've looked at the supply chain for the sedatives and the anesthetics that doctors need to put COVID patients to sleep and to keep them calm in ITU. I've also looked at the supplies of medical oxygen, because oxygen is one of the only treatments that we have for COVID. And then Jackie touched on this a bit, looking at the situation in Kenya. I looked at it in Uganda about how the police are using COVID laws to target particular groups, so like the LGBTQ plus community or people living with HIV. And more recently, I've been looking at global inequalities with regards to COVID vaccines. So I'll talk about that work first, because I think that's recent. So I'll just give you the kind of the global picture, but then talk about my work in Latin America. So as you all know, and as Alannah just mentioned, on the global level, there's been this really unequal distribution of COVID vaccines. Of about 508 million vaccine doses given globally, roughly 3/4 have gone to only 10 countries. So at least 30 countries have not injected a single person, and that's including doctors and nurses on the front line of the pandemic. So while we're seeing in Israel, 18-year-olds can get the vaccine or have got the vaccine, health workers in some of the West African countries are treating patients every day and haven't had the vaccine. So as we saw with the PPE, instead of having global coordination and solidarity, we have this sort of Hunger Games style bun fights where countries are in competition with one another and they're fighting each other for this finite supply of vaccines. And the richer countries, or countries like India that can manufacture the vaccines, have snapped up more than half of the world's supply, and that's left fewer doses for low and middle income countries who might have less clout because they can't pay as much for vaccine, or they haven't invested in the research and development for vaccines, or they don't have any manufacturing capacity locally. And it leaves fewer left for COVAX, which is the World Health Organization backed mechanism for delivering vaccines to the global south. So campaigners are using this phrase, as you phrased, Alannah, that we've got this global vaccine apartheid. So given that, we at the Bureau started trying to talk to government officials in low and middle income countries to ask them what it was like to operate in this marketplace and about how negotiations were going, given that there was this kind of fight to get vaccines. And one official I spoke to from a Latin American country that I can't name because it signed a confidentiality agreement with Pfizer, said Pfizer had been the most difficult company to work with, and the government felt that they had been bullied and held to ransom by Pfizer during these negotiations. So they told this story of how negotiations started promisingly, that Pfizer was the first company that they met in June last year, but that slowly these negotiations turned sour. So back in June last year, at that point, the vaccine hadn't been shown to be efficacious yet, it hadn't been approved yet, and the mRNA technology was quite new. Yeah, they described how Pfizer had this good cop, bad cop negotiating team, and the bad cop said to them, "Why are you only buying this number of doses? People will die because of you. You should buy more." So fast forward to October, November this year, and this country was really desperately trying to get a deal signed with Pfizer so it could receive these vaccines, because more and more people were. But they said Pfizer made these demands in negotiations that went way beyond those of other companies. So all the vaccine manufacturers asked to be indemnified. And what that means is, in the extremely, extremely rare event that there are adverse effects from the vaccine and somebody sues the company, it would be the government rather than Pfizer or another manufacturer that would pick up that bill and pay legal costs. And that's fairly typical. And it's born out of this philosophy that vaccines are very safe, vaccines protect everyone in society from an infectious disease, and that if we're going to ask the companies to make these vaccines very, very quickly and put them out in the market very, very quickly without the usual years of testing, then the government on behalf of society should bear that cost of compensating the really, really, really small number of people that might suffer an adverse effect. But what happened in this case, what the government officials said, is that Pfizer wanted these expansive additional indemnity protections. It wasn't happy with the usual protections offered to the other companies and the protections that COVAX recommends. It wanted more. So since then, an NGO has managed to obtain a contract between Pfizer and the Dominican Republic. So we can see the exact wording of the contract and just how expansive the indemnity protections Pfizer asked for are. And Pfizer is asking governments to indemnify them for problems at every step of its supply chain. It means if Pfizer makes a mistake in its clinical trials, factories, for example, if a microbe is introduced into a vial, if it's incorrectly, if there's a problem, if, for example, there's a breakdown on the way to delivering vaccines to the government.
Yeah, I'm afraid, Madlen, you're breaking up a bit, but we're going to share your articles on that in the chat so people can take a closer read at that and all the evidence, and hopefully maybe it's an issue with the Wi-Fi. Well, I assume it's an issue with the Wi-Fi. Yeah, that's it's such a shame. Can you speak now? Maybe it's a bit better.
Hi, perhaps. Sorry about that. Shall I carry on?
Yeah, do try.
So sorry about this. Yes, so Pfizer was asking to be indemnified at every problem, at every step of its supply chain. So that means if Pfizer made a mistake in clinical trials, in manufacturing its vaccines, problems in its factories, in storing, its laboring, then the government would have to pay legal costs and compensation for Pfizer.
Okay. I think we've got that. I think we might have to go to some other speakers because it's just breaking up a bit too much. But that was an interesting overview, and I don't quite know what to make of that because partly I think it's to be expected, but I know that Pfizer didn't strike a deal with Brazil and Argentina because of those clauses. So I guess it's another example of logistical, cultural, government issues and slight corruption, arguably. I don't know. Okay, so I wonder whether maybe we can go back to Jackie to expand on a few points that you were making. I mean, perhaps. Sorry, I can hear myself back now. Okay. I'd actually quite like to get this conversation out in the open as well, because a few people have said to me, well, Africa just doesn't have as many COVID cases. It's a much less mobile country. Thank you. And clearly, like, there were decisions made to go into a rapid lockdown. So it would be great just to get your, just if you could just like sort of kind of nip that in the bud once and for all. Anyone watching this who might think that like, well, less people are dying, obviously because less people are being tested for it. If you could.
Yeah, Africa's sure. Well, first of all, there's not a lot of testing that's being done in Africa. So we're not exactly sure of all the numbers. I do know my colleagues in Kenya right now are going through a third wave. I believe Bloomberg just reported on another variant coming out of Tanzania. We also saw another variant in South Africa. South African scientists discovered this mutation. These are very, very concerning. So I don't think anybody on the planet is safe from this virus. I mean, Africa as a continent is a fairly young continent. It has a lot of young people, which may give it some advantage. It is highly globalized. We saw a lot of the wealthy Africans traveling and bringing it back to the poor, which is interesting. So there is no place that is safe from this virus. and we should not be complacent. And I really would recommend people reading the latest article by Nanjala Nyambola in The Nation, for a sense of how they're feeling. And I'll just quote her quickly, if you don't mind. She goes, "I'm not sure how to describe what it feels like to be one of the millions, perhaps billions of people for whom there is no plan. Abandonment only scratches the surface of being condemned to the detritus of international greed and human folly." I just want to say, my daughter got COVID this week, and I have been vaccinated. And the ability for me to feel that I don't have to fear getting sick from caring for my daughter is incredible. And to know that there are mothers, fathers, grandparents, children, all in this, facing this across the world is devastating. And I do think that international greed and human folly are perhaps the correct words here. So I don't know if I put that to rest once and for all, but I gave it a shot, Alannah.
Thank you. And Madlen, I wonder whether I could ask you a question on something else that you've been reporting on, which is the lack of medical oxygen in several African countries and European countries charging extortionate prices for medical equipment there. And perhaps you can talk about your reporting into that and the conclusions that you've drawn, and perhaps what you think the international community can be doing more to support not just the vaccination sort of process, but access to medical supplies in this pandemic.
Yeah, thank you. So sorry about all the technical issues. So I looked at medical oxygen because basically oxygen is the key treatment that we have for COVID. So a lot of the kind of global press at the moment about vaccines, but there are people getting COVID now, and oxygen is one of the only treatments that can help them stay alive. And in the West, we take oxygen for granted. So people might not know this, but outside hospitals, there are big tankers and trucks come and they deliver liquid oxygen to our hospitals, and then it's converted back to gas and is pumped to a patient's bedside. But in sub-Saharan Africa, that infrastructure just doesn't exist. So the way that they get medical oxygen, which is needed not just for COVID patients, but for surgery, for trauma cases, for when women are giving birth, it's used as a drug for many different medical problems. They get oxygen through these big oxygen cylinders, but it's a lot less. It's a lot more logistically difficult to deliver these huge cylinders. So what we found when we looked at the price of oxygen cylinders across different countries in Africa is that it ranged from about $23. This is for a standard cylinder that would keep one adult alive for about half a day to a day. It ranged from about $23 in Kenya to $112 in Guinea. And there were additional costs on top of that. So hospitals are having to pay cylinder deposit fees of $300, monthly cylinder rental fees of about $25, paying to transport cylinders from gas company depots, which were usually in the capital cities. If you can imagine that to rural areas where there are bad roads, delivering these kind of huge tankers of big oxygen cylinders is hugely difficult and expensive to pay for the fuel and the transportation. So some hospitals needed up to 80 cylinders a day. So the costs got to, thousands of dollars, and that was just far too expensive for many health systems and hospitals. And two European companies we found. So the result of that huge expense was that basically in many countries across Africa, oxygen is only available in kind of big city hospitals. If you went to your average health center, your average kind of district hospital, there isn't any oxygen, or there's only a few cylinders, and that's just not enough for the huge surge in COVID patients that all need really, really high levels of oxygen. And we found two European companies, one called the Lind Group, a German company which has a subsidiary in South Africa, Afrox, and Air Liquide, a French company. They dominate the market. They're sort of, the main two players in town that have the biggest market share. And so I started talking to ex-employees of those companies and analysts, and they said that these companies are making profit margins of about 45 to 88% on medical oxygen. So medical oxygen and industrial oxygen are made at exactly the same plant, but the companies charge about 3 times to 7 times more for medical oxygen than industrial oxygen. So there are extra steps that you have to take with medical oxygen, cleaning the cylinders each time, tracing the products, etc. But these insiders said that didn't really add that much onto your production costs. And so they thought that this extra price that they were putting on medical oxygen was just exploitation. And the effect of that is really horrific, and that there's no kind of nice way of saying this, but it means that patients across Africa are dying of COVID, suffocating, kind of gasping for air because of these huge prices. So we published this story. And then after that, and thanks to the work of advocates, especially at the Every Breath Counts Coalition and many others, there's this new global task force convened by Unitaid to look at oxygen access across sub-Saharan Africa in particular. So it's identified that we need about $90 million of funding to meet the urgent need for oxygen in 20 low and middle income countries. And Unitaid and Wellcome have said that they can contribute 20 million. And one good thing that came out of the reporting is that Air Liquide, one of the two companies that I mentioned, has now come to the table, and it's working with this task force on increasing oxygen supply. So in about 11 countries across West Africa, it's committed to supplying oxygen at cost for the duration of the pandemic.
Okay, gosh, thank you for that. And I guess it just shows how important reporting is. Please send in your questions if you have some. I'm going to put one from Kenny to Ido now. Thank you for joining us, Kenny. It's great to have you here. And let's read it. It's easy to attack Big Pharma, but Western governments launched a huge grab of existing vaccines. And actually, it's a shame, I think, that Madlen, you missed Ido's talk, because I think, difference of takes. But Western governments launched a huge grab of existing vaccines. Kenya expects at best to inoculate 30% of its people by 2023. I mean, is the West not creating conditions ideal to make the situation far, far worse? It's a good point.
Well, as I've said, I disagree with the idea that, as I've said, there's a kind of fixed supply and the West has grabbed most of it, because I don't really think that's an accurate way to think of it. But I won't rehash that. But in terms of the kind of broader picture of how far countries in the global South are being left behind, I mean, it's really, really, really grim. Countries in the African Union, apart from a very, very small number, expect it to be years and years before they've vaccinated the entirety of their populations. I'm sure that's right about Kenya, but there are others. I think the African Union's target is to vaccinate either 30 or 60% of its population by 2023, I think, which is, dire, considering that here in the rich world, I'm sat in Germany, I'm sure you're sat in the US or the UK or whatever, we can kind of realistically expect to be at full coverage by the end of the year, probably. And we don't exactly know how variants behave. There is some evidence to suggest that basically the kind of worrying variations that we have are independently developing in several different places towards this one particular kind of mutation of, I think, the spike protein. I'm not a virologist, so I can't speak about this in detail, but from what I understand, the mutations are kind of developing, are independently developing the same mutation, which suggests that the vaccine may have kind of run out of ways to improve. It's playing its as it were, it's playing its kind of trump card, which in turn means that we should be able to get rid of that mutation with an updated vaccine, which shouldn't be particularly difficult to develop or administer, given our experience this year and late last year. But we don't know that for sure, and I know that there still is considerable worry across the world that a mutation which could significantly evade the vaccines that we already have isn't particularly likely. It's not viewed as particularly likely, but it is viewed as a possibility. And obviously, the experience of the past pretty much 12 months, just over 12 months, have shown that there can be events which we don't think are very likely at all that end up being pretty catastrophic because we didn't plan for the worst case scenario. And obviously, parts of the world being unvaccinated, having the virus continue to spread through millions and millions of people for years and years does, because every time the virus replicates, the chances of a mutation increase. More so, I think, as far as I understand, with either people who've already had it, who have antibodies, or a proportion of the population which is vaccinated. And so the virus kind of tries to figure out how it can evade that pre-existing immunity, which is, I think, what happens with a common cold. I wouldn't quote me on any of this, but like this is kind of my basic understanding, or at least this is the way that policymakers think of it. Because like me, many of them are not virologists. So it's a danger for the developing world, but it's also a danger for the rich world, which has kind of left the developing world behind.
And it's a good Kenny's added a good follow-up point, which is kind of like, I suppose heavily suggesting that vaccine issues are just sort of symptoms of existing societal problems. But I think that goes into a nice point, because I kind of wanted to ask you, well, in a very naively constructive way, or what would we all like to see? Do we waive intellectual rights to the vaccine? I think the UNAIDS director suggested that, or they've been pushing for that, indeed. And I think someone else has put a question here about GBPM admits, I guess this is Boris Johnson admitting that the vaccine success is down to greed. And, to be fair, in a few ways, there is a point to that too. So, I mean, what oh my God, my laptop's gonna die. What do we all think what would you all like to see happen? Madlen, you're with us, so tell us, if you can.
Yeah, I guess what I'd like to see.
Okay, Jackie, what would you like to see? What are you pushing for? What does your research suggest is needed? I know you mentioned civil society organisations as well.
Yeah, I mean, I think we do have a big structural problem, and I do agree with the comments that this is really showing where we're falling short as a global community, as our institutions are not working. As Ido said, we should be planning, right, worst case scenarios. So we need to accelerate global cooperation on this. I think it's shocking that COVAX was, started by a U.S. billionaire. Like that suggests our global institutions are working properly. So we need to really ramp things up and get investment in places. $90 million to provide adequate access for Africa to have enough oxygen in its hospitals is nothing. That's pocket change for a Bill Gates or a Bezos. So there's some serious structural change. I think one of the other that needs to happen. I think one of the other comments is, about transparency. We need radical transparency, including in how our governments deal with pharmaceutical companies. By the way, drug prices in the United States are elevated compared to many other places because of lobbying that pharmaceutical companies do in Western countries. They lobby the government. So Kenny, it's easy to take a blow to to criticize big pharma, but our governments often work with them, especially in the United States here, where so we need to really start creating forces that understand that we need public investment to address these global problems that will not be addressed by the private sector running rampant, without proper regulation and not proper taxes going into systems. But in the short term, because we're not going to solve those bigger problems, we really need to support transparency at the local level and civil society in that solidarity that Alannah talked about, to really push for vaccine transparency, and also, like we did with HIV/AIDS, support lower prices, access, ramping up production. We have a really global public problem here, and we're going to have to be creative about solving it.
And Ido, what do you expect to see over the next year in the rollout?
As I said, I think that rich countries, even the ones that are at present doing fairly badly by comparison, such as the EU, I think they'll basically be done by the end of the year. Some probably by the summer, like the US and the UK, but the EU and kind of other rich countries should be done by Canada, for example, should be done by the end of the year. What will be interesting after that is to see what happens with the production capacity that has been built up. So I mentioned the kind of investment that was made by these rich countries in production capacity. So what happens to all that production capacity when the rich world is vaccinated, when all the production has been used for domestic use? So places like the US, places like the UK and the EU. Obviously, in an ideal world, we would kind of keep pumping out vaccines and giving them to poorer countries, or selling them, whatever. But obviously, there's a question of money. There's the question of who pays for it, and I would hope that the factories that some kind of arrangement will be arrived at to keep production going, so that we can kind of use what we've already done to then help the rest of the world, which is good on a moral basis because obviously we save lives, good on an economic basis because vaccines are very good economically, and also good on a kind of on a self-interested basis too, because we've talked about the risk of mutations, which obviously is lessened with better vaccine coverage. But I don't necessarily think that's a given, but it would be very nice to see.
What does that mentality will end once we all have our jabs? Thanks, everybody. I feel like, this has been slightly impacted by technological issues, but we've just touched the surface. I hope that people watching this follow up with the various work and research of our speakers today. And another question, of course, is, as opposed to what can we do, is what can we expose and critique, and that's what all three of you are working on. So it's been a huge pleasure to hear from you and have your thoughts. Thanks for giving us your time today. Thank you for watching. Thank you for sending in a few questions. It's always nice. Thank you to the European Cultural Solidarity Fund and Reimagine Europe, co-funded by the Creative Europe programme of the EU, for enabling us to have our speakers. And while we're all waiting for the global rollout of the vaccine and still a bit confined, you can rewatch our last week's conference panels, which are all online, behind the mask. And I think today's been a really nice conclusion to that theme. And although obviously it's a very broad topic, I'm glad we had a little bit of a conversation about the humongous issues that are facing so many people across the world. And I hope that we all keep our attention on how the vaccine rollout's going. And clearly it's incredibly disjointed. And I'm so sorry, Madlen, that we didn't hear fully from you. But I hope that people follow up your work, because it's really brilliant, looking at how Latin American governments are are trying to kind of deal with vaccine companies, and also some of their officials are taking Sputnik for themselves. So there's all sorts of issues there with corruption as well as government and general life. I think we've come to the end of today's discussion. Thanks so much for watching. Thanks to our speakers, and have a really lovely weekend and take care.
Thanks. Thank you so much.
Thank you so much.
Thanks for inviting me.
Thanks for coming. Thank you. Bye, everyone.
Cheers.